All right. Hello, this is Tamara Hyatt with PracticeAdmin. I want to welcome you to the last in our summer webinar series. Today we're talking about partnering with Dell coding services for ICD-10 success. We have Eric Chris, the CEO of PracticeAdmin, as our industry expert speaking with us today. Eric, are you there?
I am, Tamara. Looking forward to talking with everybody today.
Thank you for joining us. And very briefly, Eric, as I said, is the CEO of PracticeAdmin. He has nearly 15 years of experience in the healthcare industry. He's worked in senior management roles with Jackson Healthcare, McKesson, and Harbinger Corporation. And he's also participated in government boards and giving testimony in healthcare topics. So briefly today, our agenda is all about ICD-10. Coding, why is it necessary, the top 5 things to be ready for ICD-10, PracticeAdmin, ICD-10 resources, why should you be interested in Dell coding services, little about Dell medical coding services. And at the end, please hold your questions until the end. We'll take your questions. Okay, jumping in, Eric, just a brief, I know we've all heard about ICD-10, but a little brief overview of what it is and what this big data is all about.
Sure, and I hope everybody on the call has heard of ICD-10 before today. Obviously, this has been a multi-year process with a full start back in 2014. But at this point, I checked my board outside. We're at 33 days, calendar days left before ICD-10 goes live, certainly from Medicare's perspective. And that's calendar days. Obviously, business days, we have even fewer than that to get ready. But just for everybody on the phone, just level set, and some of you might already be familiar with all this, but International Classification of Disease, here in the U.S., we've been using version 9 of that coding system. Version 10 has been out for a long time, but we're finally getting ready to adopt it here in the U.S. As you can see here on the left side of the screen, there are some significant differences in the structure of the codes, and so that has meant lots of changes for software, but also for workflow inside practices and medical billing companies. So while there are some benefits, which we'll talk about, that the increased precision afforded by ICD-10 codes, that there are benefits from that, but there's also obviously complexity associated with that. And I think, as everybody at this point recognizes, if you're not ready on October 1st, that change could overwhelm your current staff, and that could then put your business, be it a medical practice or a billing company, at financial risk.
Thanks, Eric. And the thing that always has a big impact on me is the number that the codes is increasing from approximately 18,000 to 150,000. So the impact of that alone is going to have a ripple effect across everything we do. Let's move on.
Sure.
Yeah, sorry.
I think one thing to point out, and we'll turn here into this on the next slide as well, is that those are the number of possible codes, right? So because the new version 10 coding standard allows you to have additional precision and specify things like the body system and the body part and a device that was perhaps is relevant to this. And not every single one of those combinations might be real. I'm sure if you've been on the web, you've seen like top 10 silly ICD-10 codes. If you put all these various combinations together, you can come up with some silly combinations, which we probably won't see in real life. Like one of my favorites is a burn injury sustained while water skiing.
Right.
I guess that could happen if you're one of those folks who jumps through the flaming ring at Cypress Gardens or somewhere, but it seems like that would be an unlikely combination to happen, but that is one of those 150,000.
It seems a bit much, but when you think about the implications of that kind of data and the helpful data we'll get for that, it's pretty amazing. I'm going on to, so here's the impact of some of what we'll be seeing from the coding. If you can go over
right, and I won't read all this to the folks, obviously, and we have these slides available for you. But just what things are what experts are thinking right now, looking at, is that they think there's an increase, a potentially permanent increase of 3 to 4% of physician time spent on documentation to achieve the level of granularity of the very specific codes that are the reason ICD-10 is designed the way it is. And so these are all the different things that have to change because of ICD-10. So what physicians have to do, what your super bills, your encounter forms have to be updated, what health plans have to do, what the coders, the coding industry has to do. And there's an estimate that initially, until they get comfortable in this no-code set, that there'll be an initial productivity drop between 20 and 50% of how quickly they can move through a medical record and apply the correct code. And then obviously comprehensive software changes across the entire life cycle. So for software used by the payers, the insurance companies to adjudicate the claims, by the providers to create the claims, and that's what our software does, is help providers create their claims, for the clearinghouses to move those claims around, and then obviously the coding software providers themselves, folks who create like coding wizard and coding expert type softwares, they had to update all their software as well.
Right, so it's not just you, it's everybody. Everybody's going to be feeling this on that date.
Right.
So why is this happening? I know some people don't realize that this has actually been around for quite a while.
Sure. Yeah. So International Classification of Disease is set by a volunteer organization, nonprofits. They've obviously been working on this set of classifications for diseases and diagnoses for a long time, because here in the U.S. we've been using version 9, so there were 8 versions before this. Version 10, the first publication of version 10 actually dates back to 1992, and right now we're one of the last developed countries to adopt this new code set. And so why are we doing it right now? Well, if we actually jump down to the last bullet point there, the healthcare policymakers feel that with more detailed data, and that's really what ICD-10 gives you the benefit, is that code structure allows you to get very, very specific about the diagnosis, where on the body, exactly what caused the injury or the disease, even things like with injury, where you sustained the injury in the environment. Was it at home? If it at home, was it in the bathroom versus in the living room? And the hope is from the policymakers is that additional level of specificity will allow folks who work on things like reducing incidence of disease or reducing incidence of injury then to be able to use this data in a much richer and meaningful way.
Right, and
One
also
of the benefits.
it'll be great to see trends in healthcare and also in population health.
Exactly right. What's the benefit to medical practices? One is there's a potential for higher reimbursements. And how can that be? Well, one is with this additional level of detail where you can specify, here's the complexity of this particular diagnosis of this disease or this condition, a chronic condition or something else that the patient has. You can now use that higher degree of complexity then to use that as part of your justification for higher degree of service. And as well as this additional level of granularity will allow the folks paying the bills, the payers, particularly the government payers, Medicare and Medicaid, they can then use this additional level of detail to drive reimbursement rates for certain CPT codes for certain services performed because of an outcome they're trying to achieve, perhaps better diabetes management with this correlated cause, and can result in higher reimbursements. Mm-hmm. I think one thing to not panic about is you don't need to learn every code. You don't need to learn all 150,000 of those. Depending on your specialty and your medical practice or what your billing company focuses on, you only need to, just like with ICD-9, you only need to know the codes that are and the code combinations that are relevant to your specialties. And of course, there are lookup tools that are going to help you with that process. Mm-hmm. And if your practice management software, if it's ICD-10 ready, of course, can help you streamline this conversion. And today we'll talk a little about software, but we're really here to talk about services that can help you with this transition. Right.
So tell us about this. We've got the top 5 things you need to become ICD-10 ready.
Yeah, so we sat down and said, hey, if you're 33 days out, what are things, hopefully you've already done many of these, but if not, get to it. Obviously, the first thing is for anybody in your organization who's involved in coding to make sure they have some training on ICD-10, some familiarity with ICD-10. There are various online training courses. There are certainly companies that offer ICD-10 training, although as we get closer and closer to October 1st, their slots are filling up and their prices are rising as we get closer to October 1st. But at least get your staff a room, start talking about ICD-10, start thinking through, and we'll give you some tips what to do with those staff in step 3 here. Step 2 is for your staff and is identify both printed resource materials and online resources that they can then have available to them on October 1st or perhaps on October 2nd when they have to do coding for services rendered on October 1st. And the way this works is Medicare is requiring that all dates of service after September 30th be coded with an ICD-10 code. So make sure your staff has a list, up at their desk. It says here are places online that you can go to look up things about ICD-10, code lookup, guidance. There'll be lots of companies offering information. Medicare will be posting things. And one of the things we offer, Tamara, here at PracticeAdmin is that we have a ICD-10 resource page. And remind me, Tamara, that's at practiceadmin.com/ICD10.
Yes.
Correct?
Correct.
Right.
And at the end of the presentation, I'll have the link there, and people go to our website, and there's a link from our homepage as well.
So our next recommendation is to start practicing now. Don't wait till October 1st to start playing around with these new codes. So how do you practice, how do you use them right now when you shouldn't be actually using them on a live claim going to a payer because they're not ready for them yet? Well, a couple things you can do. One is go through and from your practice management software or just your personal experience, identify your top 10, top 20 recurring ICD-9 codes. Sit down with these resources and figure out, based on your knowledge, or go out to an expert and say, what's the best ICD-10 equivalent for those top 20 codes, top 30 codes, top 40 codes, and go ahead and create that cheat sheet for your staff. The other way you can practice now is take some claims or take some coding that you've done on a chart for ICD-9 and redo that with ICD-10 and see how that process so that the staff gets comfortable with the tools available for looking up ICD-10 codes and getting to get comfortable with that structure. And you could, if you have a group, if you have more than one person doing coding, have have them each do it individually, then compare notes, see if they all ended up at the same ICD-10 code, and so maybe do a brown bag lunch, 2 times a week between now and October 1st. You bring in charts, you bring in claims, and you recode them using ICD-10.
Great. And then did you go over number 4 about updating?
No, I haven't done number 4 yet. So one thing, don't wait till the last minute.
Yeah.
Most medical practices on their super bills, on their charge slips, on their encounter forms, whatever term you use it, obviously in addition to the CPT codes that the provider circles that were provided, the most common CPT codes, you also generally have your most common diagnoses on there. So you need to have a new version of your encounter forms ready to go. So don't start using those until October 1st, but don't wait till October 1st and say, whoops, we don't have a place to write this down. Go ahead and sit down as a team and create those encounter forms. If your practice management software, like our provider suite does, allows you to print encounter forms from inside the product, make sure you've talked to your software vendor and get them a copy of your new ICD-10 version of your encounter form ahead of October 1st, because they're going to be, just like we will be, really busy, and if everybody waits to the last minute, it's going to be a little backlog to get everybody's encounter form up-to-dated. So what we're planning to do at PracticeAdmin is you can go ahead now and send us your ICD-10 version of your encounter form. We'll make sure it's sized correctly and fits into our encounter form template, and then we won't publish it live on your site until October 1st.
Good to know. I have 2 things to say before we move on about talking about our coding partner. First, PracticeAdmin will be hosting weekly webinars throughout September, starting September 2nd next week, with topics targeted on ICD-10 and helping you with that transition. I'll be promoting that, sending out information about that on our website if you want to register for that. Also, Eric, I was curious, why do our billing services customers need to be informed about all of this and what's going on? How can they help in all this?
two things come to mind. One is some billing companies provide coding services to their practices, to their client practices. So if you're doing that, then obviously starting October 1st, you're going to have to be coding in ICD-10. But second, even if you don't provide coding, if the practice does the coding and simply delivers you the encounter form with the codes selected, you still need to be familiar with this process. As a billing company, if there's a problem with the coding, it might not be your fault, meaning that if you didn't do the coding, but of course the medical practice who outsource their billing and relies on you to get them their money deposited into their account and keep those claims flowing, keep that cash flow coming, is going to look to you to solve it. So you need to be familiar with this process.
Right. And number 5 is, of course, you don't have to be doing this alone. You can find a trusted coding partner, and I'll let Eric take it from there.
Sure. So let's talk about one, what we did in our software, and two, about finding a trusted coding partner. So one of the things we did in our software, in addition to enabling you to put in ICD-10 codes, which was sort of the bare minimum that our software has to do, is we built in a copy of they're called the General Equivalency Mapping, GEMS tool that Medicare developed to create crosswalks between some ICD-9 and ICD-10 codes and vice versa. Because of this change in structure, the dramatic differences in the hierarchy of the codes, it's not a one-to-one or situations. There's one-to-many and many-to-one going back in the other direction. But there is this tool available. It is available on the CMS website, but we've actually incorporated that directly in our product. So when you're in our product creating a claim, and if you can just go ahead and type the code if you know it, you can do a search for the code, but you can also then switch to the GEMS and do a lookup against an ICD-9 code.
As I say, in fact, when you do a demo of our product, you can ask our person who's conducting the demo, they can show you how that works, and we'll be doing we'll be recording that and putting that on our website as well so you can see how that works.
Right. But the most important thing we want to talk about today is, as Tamara said, not going into this alone. So even if you've done all these things, you've trained your staff, as we talked about it earlier, there's going to be a reduction in productivity. And also just the amount of training your staff has been able to do. And so we recommend finding a trusted coding partner that you can have on standby, or you can have working side by side with you throughout the transition, and maybe they continue with you beyond that. If you're a medical practice, that trusted partner might be your billing company today. If not, we have a recommendation for you. If you're a billing company, once again, we recommend going ahead and finding a partner. It could be a coding services partner. It could just be an expert coder who's on a retainer or a call for you. What we've done is we went out and looked at the market, and we identified Dell Coding Services as somebody that we felt had the expertise, and we went with them and signed a master contract, negotiated discounts because we're bringing potentially multiple customers to them. And I think an important last point there is that, and we'll tell you more about Dell and why we chose them in the upcoming slides, but Dell doesn't have to replace your current coding staff. It can simply supplement your current staff where they need it most with their experienced ICD-10 coders.
Right. And let's talk a little bit more deeply about why we selected Dell Coding Services and the value they offer.
Sure. So Dell, when you see that Dell logo there in the upper right-hand corner, you think, my laptop or my computer. Well, and Dell, and this is the same Dell. Dell, many years ago, 4 or 5 years ago, acquired a company called Pro Systems, which was a consulting professional services company, and they had a long record of healthcare professional services, including things like healthcare revenue cycle management, and one of those pieces is coding services. So they actually have over 400 trained coders, 25% of which have achieved the senior level certified coding qualification from the AAPC. And so we selected them as a partner, and one of the things we work with them to do is to try to simplify your transition to them, to make it easy to get up and running with them, and goal, of course, is minimize any interruptions from ICD-10. And one of the things we did was we worked with them to price their coding services per transaction. So you're paying only for what you use. You're not paying for somebody, let's say on retainer, who if you don't use them, or you're not paying a fixed amount per hour, per day, per month with the price plan we've put in place with Dell. It's simply a per coding event, essentially per chart charge.
It just makes sense too. They are trained in this. They've been using it, and they can come in and essentially help train your coders. They can work with them and make sure they're doing it correctly.
Right.
Thank you. Let's go on. Okay, so this is sort of a high-level view of the value again of what they can do for you.
And some of these slides are directly from the presentation that Dell has put together to educate folks, and there's lots more detail behind this slide and the next slide. And if you're interested in learning more, we're happy to facilitate the introductions and participate in getting you on a call with a representative from Dell and a representative from PracticeAdmin, so you can go through this in detail. But just in summary, as we've talked about, hundreds of medical coders. In terms of volume, they currently support, in terms of just their coding services, let alone their other revenue cycle services, over 7,500 physicians, 75,000 medical charts reviewed a day, so that's over 20 million a year. They've built some cool workflow tools. They handle a variety of specialties with expertise, and we can see some of those there in the top right: anesthesiology, emergency medicine, surgery, pathology. But their list is very extensive, and odds are your specialty or specialties, if you're a billing company, are on that list.
All right, and if we take that a little bit deeper, this is sort of the full view of the full service solution. If you need additional services and what else they can do for you.
Yeah, so some of this is potentially overkill for a individual medical practice or a small billing company. But if you're a larger billing company or a larger provider, a very large practice, they can come in and do all sorts of things related to revenue cycle management and coding services. Because we're sitting here on August 26th, they won't necessarily have time to do all of this deep level of detail by October 1st, but they can certainly get you up and running with coding staff. They've built their own code finder tool, which they've been using with ICD 9, and they have upgraded that to include the ICD 10 codes, of course, and the crosswalk built into it. That's something their internal staff uses, which is also a knowledge base for them. They train their coders. They have their coders complete the AAPC proficiency assessment. We've just found they do a great job in coding services.
Great, thank you. Moving on. So briefly, Eric, before we get to some questions from our audience, tell us a little bit again about PracticeAdmin and the value for our customers of being with PracticeAdmin.
Sure. So I guess the price of sitting through the webinar talking about things that can help you get ready for the ICD-10 transition is you get to hear a little bit of a sales spiel from me. So who's PracticeAdmin? So we're a software company. So we don't do billing services or coding services. That's why we partnered with Dell for the coding piece. But we are focused on medical billing companies and medical practices, and our goal is to help you run your business from the billing, patient accounting side. We are not a bundled solution. We're not also an EMR company trying to do both EMR and practice management. We are 100% focused on practice management, on the scheduling, billing, claims management, payment posting, keeping track of every claim and every dollar moving through the practice. Our software was developed by medical billing professionals, so not by folks who said, hey, I think I know how to build an EMR because I've been a patient and I'm going to ask a bunch of doctors, I'm going to create an EMR. Because medical billing is such a complex process, I think you got to have medical billing professionals, not amateurs, designing your software, and that's what we did. And our focus is on truly not just submitting the claim, but on managing that life cycle of that claim and making sure no claim slips through the cracks. And one of the things we did was design it not just for individual medical practices, but we also have functionalities for the unique needs of medical billing companies with their multiple client accounts.
Right.
Now, we're not since we don't offer an EMR, but obviously EMRs are relevant to the medical practice space. What we do is we partner with several selected EMRs, but we also integrate with any EMR out there that supports what's pretty much at this point an industry standard, what the HL7 interface language for moving patient demographics from our system to the EMR, and for if the EMR has a charge capture module for moving those charges back into our system. So we work with any EMR.
So the nice thing is you can have the best of both. If you already have a system you like, an EHR system, you can use us as your top practice management system. And on top of all that, PracticeAdmin is ready for ICD-10.
That's right.
We have been ready, I think you said since the spring.
Well, yeah, actually, thanks to Congress and their infinite wisdom, we actually did all the coding, the software coding, not to confuse coding types here, back in the spring of 2014, because we were working to be ready by October 1st, 2014.
And it's really going to happen this time, right?
Well, there's always a chance. You never know. Congress does come back from their summer break in September. They've got lots of things they have to vote on, and I suppose something could slip through, like happened last year, although it happened much earlier in the year, where they prohibited the CMS from moving forward with ICD-10. But at this point, I think even if there's a chance that could happen, we still all have to proceed forward, full steam ahead, that this is going to happen on October 1st.
From everything I've read and seen, it is going to happen, but one sort of concession that CMS has made is they are not going to enforce, if I recall, the penalties for at least a year.
Well, what they specifically said is, and they worked in partnership with the American Medical Association, who obviously came to them on behalf of the providers out there. And what they said was, because the providers, of course, are worried about their cash flow, saying, hey, we're still learning this new coding system. If you deny the claim, and because we have the wrong code, we're happy to fix that, but of course that introduces lag in the payment cycle. And I've got payroll to meet, I've got to pay my rent, and all those sorts of things. So what CMS and AMA negotiated is that if you submit a claim after October 1st, so for 1 year, and the only thing wrong with that claim is that you weren't as specific as you could have been with the ICD-9 code, but you were at least in the right family of codes, right? So if it's a burn injury, you're at least in the burn injury category, not in the diabetes category of diagnosis. So if you submit that and you're not as specific as you could have been, they won't deny the claim. They will process it and pay it. Now, one thing I said, if that's the only thing wrong with the claim. So if there's something else wrong, like, I don't know, the patient wasn't eligible, or you're not meeting some other requirement that Medicare has for the claim, it will still also reject. They will reject it for those reasons.
Right.
And they might tell you in that rejection that ICD-10 code is they'd like more details on that, but they won't not pay a claim if the only thing missing is the specificity of the ICD-10 code, as long as you're in the right family.
Great, thanks. And right now I want to open it up to any questions from our folks attending the webinars. Please go ahead and submit those questions. We do have a couple to start with. Eric, you ready?
Sure.
Let's see. Okay, this goes along the lines of what you were just discussing. What happens if we continue using ICD-9 codes or if we're using the wrong codes?
Sure. So I think one thing that's going to be important is that Medicare, so Centers for Medicare and Medicaid Services, is the one driving this change. They're the ones with the October 1st deadline. And that, of course, applies to them as Medicare. They can't force commercial payers to also follow the deadline. Now, most commercial payers are also working towards that process because they recognize that it's going to be tough to have two different code sets. But so one of the things you need to do is got to check with the payer requirements. So our understanding, of course, what happens if you continue using ICD-9 codes? So for Medicare, if you have a date of service after September 30th, if you submit it with ICD-9, that will be rejected. Now, another payer might say, no, that's okay, I'll keep taking ICD-9 codes. So you're going to need to go, so that's another great prep thing to do, is go check out your top 10 payers, go to their websites or call their support lines and say, what is the status of your adoption of ICD-10? Will you be enforcing it on as of October 1st? We also anticipate that maybe some payers, we have a whole complex payment system here in the U.S., so some things like workers' comp payers, they're not mandated to adopt this. They might just say, we're fine with the way it is, keep sending us ICD-9 codes.
Right.
So one of the things we've done in our software is on October 1st, we're not forcing you to do everything ICD-10. By claim, you'll be able to choose 9 or 10 codes on a particular claim. And then if they get it rejected and they say, no, we need the other one, you can go back to that claim, flip it back. We can't automatically choose the codes for you because, as I mentioned, there's no one-to-one crosswalk for every 9 to 10 code and vice versa. But we will present you with what you had. Let's say you submitted with 10 codes, and the payer says, no, we need it back as 9. Switch it back to 9, redo the diagnoses, and hit resubmit.
Right. Now, I have another question. As a PracticeAdmin customer, does the customer have to have any interaction with the clearinghouse, or do they just come to us?
Yeah, that's right. So with PracticeAdmin, we front end the clearinghouse relationship. All those services are bundled into our monthly service package. So no, in terms of you don't have to go and test yourself with the clearinghouse or those sorts of things. We'll be handling that relationship. For other folks out there with different software packages with direct relationship with clearinghouse, I obviously can't speak directly to them, and certainly recommend that you give your clearinghouse a call and see if there's anything you're going to need to do in your software.
Okay, great. I've got some comments here. Let's see if I can go through some of these. I know we had some industry ICD-10 experts also attending. This is from Medical Management Institute. It says, we are a training institute specifically for medical professionals in the outpatient patient physician office setting. And they do offer customized live and online training options for coders, billers, managers, clinical staff, and providers. So I'm going to encourage you. We can put some information about them and put you in touch with them. Thank you.
Sure.
It says,
we can add that to our ICD-10 resource page.
Yeah, we'll do that. Sounds great. Let's try and see what else. I would, offer some customer options. So they would be happy to work with you guys on that, and we'll add their information. And I'll do a follow-up email as well with a link to this recording and also some information about our resources. I've got just a couple other questions. How do I know if my EMR is ready? And I think we addressed this a little bit, but Eric, can you answer that a little bit more?
Sure, and I think that's probably the key question because the diagnosis starts with the EMR. Obviously, there might be still some practices who are still doing it paper-based with paper charts, but so you capture, you record the diagnosis, or you do the coding in the EMR. So how do you know they're ICD-10 ready? Well, one thing is to simply pull up your software and see if they have a radio button or a checkbox where you can switch to ICD-10 codes. If not, obviously check with your EMR. A couple of our EMR partners here at PracticeAdmin, I'm on their mailing list, and one of them, Savacity, out of Texas, just sent out a great little email that says Savacity is ICD-10 ready, and they had a little video that you could watch that's showing the screens in the product and how they've been updated to accommodate the ICD-10 codes.
Great. Okay, final question here. Again, who do I contact about using Dell coding services?
Sure. So you could contact them directly, but to get access to our discounted rates and that master contract we've negotiated, you're going to want to contact PracticeAdmin, and I think the best way to do that is by email at sales@practiceadmin.com, and just make sure you put Dell Coding Services in the subject line, or if you want to give our sales team a call directly, the phone number on our website is, but also I'll say it here, is 678-269-4780, 678-269-4780. Option 5 will put you right in touch with a person ready to help you with coding, practice management software, and anything to do with medical billing.
And again, all that information is on our website and on our ICD-10 resource page. I want to remind people, again, we will be hosting a weekly webinar series in October starting September 2nd. I'll have all that information posted shortly, and I'll have it in our email follow-up to you. And if you would like a copy of this presentation, just drop me a line at marketing@practiceadmin.com, and a recording of this webinar will be available on our website by the end of the week. Any other questions before we conclude today's webinar? Great. Eric, thank you for joining us today. Good information, and I think we'll be hearing more from you in September in some of our other ICD-10 topics.
It's been a pleasure, Tamara, and we're looking forward to working hard to make this as smooth a transition as possible for our customers, and it's going to be a fun ride, I think.
Yes, I still like your idea of having I survived ICD 10 t-shirts. So,
There we go. There we go.
all right, everybody have a good day. Thank you. Bye.